Hey everyone, welcome to the main event. My name is Joe Tillman, and you are on, or maybe you're on, the hair transplant channel. And the main event hasn't been on for quite a while. A lot of stuff's been going on, but welcome back if you have been watching in the past, and welcome if you've never been here before. My name is Joe Tillman, and I have pretty long history. Whoop. Uh-oh. Hold on a second. I'm hearing noise. There we go. Okay, back to that. I got all kinds of audio feeds coming through the same source here. Yeah, been in the industry for almost 25 years now. I am a repair patient myself, had multiple hair transplants, and fast forward to today, 2025, I am out here talking to all kinds of doctors, working with many different doctors to help bring them to your attention and explain why I like the different doctors that I work with. And speaking of which, I do happen to have one of the doctors I'm working with. His name's Dr. Danyo. He is on the line with us or on video with us. I'm going to switch over. There we go. Hey, Dr. Danyo, welcome to the main event. How are you?
Joe, thanks for having me on. I'm great. How about you?
I can't complain. Well, I can complain, but no one really cares, so why bother? But no, it's good. Thanks for coming on today. Glad to have you on. And this is actually the first real exposure that you're having to my audience as a hair transplant mentor member doctor. You came on board, I think it was 2 months ago. We're in November, so I think it was in September.
Yep.
And we've known each other for several years, and it's when you came over to talk about doing this again, because we've discussed working together in the past. I look at it now compared to back then, and it just makes a lot more sense now. It feels right because of all the things that you've been through. So it was good timing on that. Why don't you take just a moment to tell the audience about yourself and what you do?
Sure. Well, I've been doing hair transplant. I started in 2011, kind of learning the trade, and actually come from a pain management background. And back in 2011, it was just dark times with the opioid epidemic and just insurance. And I just wasn't happy. And I ended up taking a hair transplant course. And it was like, my gosh, I have my new love. So I quickly just immersed myself in trying to get connected with some of the top docs and mentoring with them, actually going to their offices, doing as many courses as I could, and then just really perfecting my craft. And I think my craft has been pretty differentiated as early as 2012, because I've always kind of focused more on a stealth, shaveless approach. And that is kind of what we do 70% of the time for our male patients and 100% of the time for our female patients.
Yeah. And that's the way that you've always stuck out in my mind over the years is the doc that does the no shave FUE. And it's not very common. There are several clinics that advertise that they offer that. But what I remember about you is you basically made that pretty much the standard approach that you would take. And if there's a shaving situation going on, at least this is what you used to tell me, it was at their request, not yours. Because you got so used to doing a no shave FUE that you just preferred it. And I don't think it's all of your, well, not all of your patients now, but you told me that I think you said 70% of all of your patients are no shave. Is that accurate?
Yeah. And now we're doing long hair, preview long hair cases.
Yeah.
If you look at my clientele, it's a huge spectrum, but you could have somebody as high level as a professional athlete. I've had people that are on TV, YouTube, influencers, but then I've had, just ordinary people that, just want this to be a concealed. I mean, as concealed as not even letting their wife or their spouse know that
Yeah.
they had it done. So,
Yeah.
um, and I've been able to perform these procedures in a way where we don't do any pre-trimming.
Hmm.
And I've done millions of grafts. I've done well over 5,000 cases.
Right.
Up until about 3.5 years ago, I extracted and placed every graft.
Yeah. And what's your total involvement now? Because you had to give up a little bit of that simply because I'd imagine
Well,
the human risk can only take so much.
well, I mean, we, like I said, we continue to perfect our craft,
Yeah.
and that's what I call it. I mean, it's a constant, energy to reflect, and we reflect almost on a daily basis
Hmm.
because there's so many variables that go into hair transplant. And when people are looking online, they look at these pictures and they think, oh, I should look like that, or why don't I look like that after
Hmm.
a hair transplant? And so these variables come into play with every patient. In
Yeah.
fact, for us, we have 4 steps. We have to core the graft, we have to pull the graft, we have to load the graft into implanter pens, and we have to place and keep everybody comfortable.
Hmm.
Any one of those steps can have major variables, and then you throw in age, length of hair,
Hmm.
curl, splay, just all the other natural factors. Um, there are certain things that we've learned nuance wise that improve our efficiency and
Hmm.
make it fun and comfortable for everybody.
Nice, nice. And just a reminder for everyone watching, this is a call-in show. I haven't announced the number here, but it is down in the bottom right-hand corner of your screen. I got 2 numbers up there. One is North America toll-free. It's 1-888-491-0512. We are going to be taking your questions. We also have a United Kingdom number. It's 020-8126-7771. Lines are open, and hopefully they work. This is the inaugural broadcast in my new studio, and hopefully I got everything connected properly. So do give us a call, and I'd love to hear from you guys. I know Dr. Danyo would love to hear from you guys as well, and we'd love to answer your questions about hair loss, hair restoration, and all things related to hair. Doc, you're in Atlanta, Georgia. Can you have you been there since the beginning of the clinic, right? Is that, or did
Oh
you have a
yeah,
clinic
yeah.
before?
I've been here since 1995. I did my residency at Emory.
Okay.
I grew up outside of Philadelphia. Um,
Right.
I like to say that I'm northern born, southern bred. So I've lived more of my life in the South than in the North.
Yeah.
Um, but I love it here. We're in Alpharetta, which is about 40, depending on traffic, could be 30 minutes, could be an hour
Yeah.
north of Atlanta.
Yeah.
Beautiful town. It's a great experience when patients come. We do a lot of patients throughout the country, even internationally.
Yeah.
And it's a common theme like, wow, this is a gem. And we're nestled right in the village of Alpharetta
Hmm.
with hotels and restaurants and bars, walking past. I mean, it's a great experience, especially for the spouse.
Yeah. Of course. Yeah. It
Oh,
gives
yeah,
them something to do. Once
yeah,
once they come in and feel the place out, make sure their husband's going to be okay. They can take off and enjoy the area. I used to live in the area. I used to live in Peachtree City, just south of Atlanta. Um, Around the not long after you got there, actually, I had 96. 96 is when I moved there. I was only there for a year, but my family's from Georgia anyway, and so
yeah.
I'm familiar with the area. But it's nice. Um,
Awesome.
you did you ever work with strip surgery in the past?
I never did.
Yeah.
No, I just saw it as it's a different business model for one.
Yeah.
And I mean, there are definitely limitations with FUE.
Hmm.
But I've always focused on the donor site, not as just being a commodity, but really kind of a resource for the patient. And I'm managing a resource, kind of like a financial planner manages somebody's bank account. I mean, and this is
Right.
gold.
Yeah.
So if you're going to be messing with somebody's bank account or gold, you better do a good job, which means you need to really perfect grafting, donor site managing, planning, what's going to happen. The
Hmm.
other thing, for people that have huge areas to cover, we do a lot of beard and body hair extraction. And I've done
Okay.
some really massive cases of patients that, especially that have gone through like strips and plugs. I'm talking back in the late 80s, early
Oh
90s,
yeah.
and just had a lot of scarring, minimal donor site left over, kind of disconnection between like the top of the head and the side as
Hmm.
things kind of eventually thinned out,
Yeah.
and just had some great outcomes. Yeah, a
What
lot of
what
work.
what would you say the number, or we'll say percentage of cases a month are they where you're employing body hair or beard hair? I don't know how you classify them, but I separate them when
Mhm.
talking about body hair versus beard hair. I don't incorporate them into the same terminology. So I like the
Likewise.
distinction. Yeah. So what percentage do you think of your cases involve one or the other?
Yeah, I would say I incorporate beard much earlier than most.
Hmm.
Um, I do at least 3 or 4 beard cases a week, and
Hmm.
right now we're doing about 10 to 12 cases a week in our office. I have another physician in the office and PA, but we're extremely busy, efficient, especially if you're looking at the frontal hairline, the mid scalp, and the crown, and then people come in and their donor site is okay, but it's not going to be sufficient to cover everything. So
Yeah.
you need to make that decision earlier than later to say, you know
Of
what,
course.
we need to do a proportion of beard hair, potentially chest and even abdominal hair,
Hmm.
um, to make this thing happen. And the coarseness is always an issue for folks. They're worried about it, but um, I don't see it. Very occasionally do I have patients complain about it, especially when you do it correctly. You're not going to put like a strip of beard hair and then have regular head hair. You need to
Right.
incorporate it.
Well,
And
it
so,
also, sorry to interrupt, but it also comes down
um,
to uh, uh, donor or patient selection, where you wouldn't incorporate very coarse, curly beard hair into someone that might have finer, straighter scalp hair.
yeah, but I've done it, and they've done very well.
Okay.
And everyone has different needs. Everyone has a different response
Hmm.
after the procedure. Um, you know, um, Perception is reality, and
No,
uh,
true, but that begs the question. And I didn't plan on going into the subject, but I think it's interesting. That begs the question about uh, donor dominance or recipient dominance. In other words, um, d- do you notice any sort of we'll call it the wives' tale of beard hair taking on characteristics of scalp hair, or we'll say different characteristics once they're transplanted to the scalp due to the increased blood flow, or from
uh,
anything? Are you seeing any sort of change in how the hair behaves?
potentially, and because I do so much beard hair, and I really don't hear a lot of complaints,
Hmm.
and we do great follow-up at 6 months and 12 months. It would be maybe 1 out of 10 that says, "I don't like the coarseness," or, "It feels funny." It's more of a feel thing than a look thing.
Yeah.
Um, and even I can think of a patient that we worked on, that had multiple strip procedures with little fine baby hair. You could
Hmm.
see this. He had 2 strip scars. You could see right through his donor site.
Yeah.
And But we ended up doing 3 beard cases, actually totaling
Wow.
6,000 grafts, going
Okay.
from front to back, and he had amazing results. So that difference between the beard and and the baby fine donor site really wasn't an issue for him. I mean, he was ecstatic.
Yeah. Well, okay. Well, that's interesting, and of course, that's what matters: the patient being happy. I remember over 20 years. Well, yeah, over 20 years ago, that was early on a discussion where Ray Woods, who is basically the father of FUE, and as we know it today, he was pushing that narrative that body hair, not so much beard hair, but body hair like chest, back, leg, whatever, if transplanted to the scalp, would eventually take on the characteristics of scalp hair. And he had one patient that he was using as an anecdotal reference where it was all chest hair in this guy's head. And he had a tape measure next to it, and the guy had let it grown out and it was a foot long. So
yeah, that seems a little hard to believe.
I mean, it's okay.
I think that
it's one case, so obviously it's not a controlled study of any sort.
Sure.
But,
I definitely think the length of the chest hair can grow longer when you move it to the head, but the coarseness and the diameter does not. I've seen, everyone has different characteristics in their beard and chest hair. I mean, some chest hair is like super straight, and some is really curly.
And like in my own case, my chest hair is pretty similar to my scalp hair as far as the texture. It does have a little bit more of a wave, but it's not tight curls. And in 2006, I had a small test session in 1 square centimeter in the right hand side of my crown, and had a terrible survival rate out of maybe 80 grafts or so. About just over a third of that survived. But the ones that did survive, they continue to grow to this day. And last time we checked with my doctor, they're still growing longer than they would in my chest, and healthy and blending in perfectly with my scalp hair. And, it's something to consider for the future. If I ever want to make this back region a bit fuller, I'd feel okay about that. I'd feel good about it. The only problem was back then it was such literally an experiment. I mean, we had no real expertise with FUE to speak of, much less body hair. But I have a bunch of punctate wounds all over my chest. That's
still?
Yeah. Oh yeah. Still.
Okay. Wow.
Yeah.
Well, I think, things have been perfected a little bit more.
Oh yeah. This was like a 1.2 millimeter punch. And, I had like 3 techs working on me and the doctor, and they're all trying to I was a guinea pig. Like it doesn't get more guinea pigs than that. So I'm fine with it. It doesn't bother me at all.
Well, now that you kind of brought it up, but FUE, because I think of you like your technical literacy of hair transplant in the industry. It's really remarkable. I mean, you were bitten by bad hair transplant and really recovered with great results. And modern day FUE with the hype and the marketing and all that stuff, they make it seem like everybody's the same. There are no variables. We talked about that earlier. And it's really easy to do. It's actually extremely hard to do. And especially if you're doing a shaveless procedure, also called no shave and unshaven, or especially now preview long hair. These are extremely hard technical cases. But in adding that level of difficulty, you still need to get perfect grafts. And unfortunately, I hear all the time when I do consults, well, I had a consult with 2 other doctors, and they said the shaveless FUE gives horrible grafts. And I've been doing this, like we said earlier, 2012, 2013. I have perfected the technique over millions of grafts to get perfect grafts. We're not having transections. They're not delaminated. The growth is the same as if you had it shaved. But unfortunately, people are kind of pushed away from that as an option. And really, I never, when I do consults, I'm never like in a sales mode because we're busy all the time. I'm happy to help anybody.
Well, and that's the way it should be. And just a quick reminder to the people watching live, it is a call-in show, people, and lines are open. We got 2 lines. North America line is 1-888-491-0512. In the UK, you can call 020-8126. 7771. Dr. Danyo live from Atlanta, Georgia, here to answer your questions. Of course, I can as well. Doc, let me ask you. So, um, I think I know the answer to this question. Have you been to any of the big conferences lately, like the ISHRS? The most recent one was in Berlin. I don't think you went to that one, but have you been to any of the recent ones?
Oh yeah, I was there in Denver.
Yeah, and
Yeah.
that was last year.
That was last
Yeah.
October, and then yesterday I just got the link. They just sent that out for the people that did not go that are members of the society. So I
Real
do
quick,
plan on.
we do have a call coming in. Let me cut
Excellent.
you off there. So let's see if this works. Hey, thanks for calling the main event. You're on with Joe and Dr. Danyo. Can you hear me okay?
Oops. I can hear you. Hey, Joe, it's John from New York.
Hey, John, how you doing? Doc, can you hear John from New York?
I can.
Okay,
hey,
John. Can you hear the doc?
I can hear him.
Yay, it all works. Okay, awesome. All right, what can I help you with, John?
Well, I think you know my story, Joe. And what encouraged me is that Dr. Dan was talking about, he does a lot of beard transplants, and I could explain to him that I've been rejected by basically, 3 doctors because of cancer. I have very minimal donor area, but I have a very, very thick, full beard.
Yeah.
And I wasn't really looking for a lot with the doctors, and some doctors said that I could do 2,500 grafts, but some doctors said that it's not really worth it.
Yeah.
But I haven't really seen anybody that can do anything with the beard. And I was encouraged. I'm throwing a holy grail out there.
Yeah.
I think my situation is hopeless, but.
Well, tell me. So you went through chemotherapy, and lost your hair, or what happened with the cancer?
Well, I went through chemo many years ago, and instead of 3 hairs coming out of a graft, I have 1 to 2, so I have a minimal donor area. But I have high temple points. The last doctor I went to see was Dr. Benham, and he said, we could do something. He says, but I'd like to do a laser thing before, like at least a year, to get your hair kind of back up, because he felt that the laser was promising.
This is the Folligraph, right? Not any laser, but it's the new Folligraph. I think it's called Folligraft.
I think he said he and another doctor have it. I was telling you and Spencer a couple of Fridays ago. But now Dr. Wong in Vancouver, I told him basically I just wanted to have a little bit on top and get some. He doesn't do any beard, but he said he could give me 2,500 grafts. Dr. Mercino also said he could do 2,500 grafts, but he didn't think it would make much of a difference. Dr. Wong said it could, but both of those doctors didn't have anything with a beard. So Dr. Dan is doing some beard stuff. So I thought, I don't know, maybe there's a shot.
So what areas are you looking to cover? I mean, you're talking going from the frontal hairline, the temporal areas, back to the crown?
Yeah, I'm not even looking for crown. I'm just looking for the top. So if I'm on and I'm going to be doing interviews because I'm doing movies and stuff like that. So if I was on, if I just looked decent in the front and had some frontal coverage, and then minimal on the sides. And Joe's seen my pictures. I'm my temple points are there, but again, the donor hair on the back is not really there. But my beard is very thick.
Yeah. I mean, from my standpoint, obviously, I haven't seen pictures, haven't seen you in person. I mean, this is the type of story I hear all the time, that beard and body hair are just not even mentioned. And if they are, it doesn't work. The graft survival rate is terrible. I find it's the exact opposite. The other thing is, we're using extremely small punches, even less than 0.9 millimeters for the beard. It heals extremely fast. Literally by the next day, there's so much wound contraction. There's really minimal visible wounds, just some redness. So the
Wow.
healing's really fast from the beard. The numbing's easy. It's a pretty shallow extraction. But really, what the beard does is it just opens up the door of possibilities, and that's what you need. You know,
Mm.
I have talked to this
The
with my
other odd
patient.
thing about my, oh, go ahead, Doc.
Okay, no, go ahead.
No, I was just going to say the other odd thing about my beard. I grew it out for Dr. Benham. He felt he could get at least 1,000 or maybe 1,500, even more. And the odd thing about it is that my beard hair is kind of not on the coarse side; it's thick, but it's on the soft side.
That's great.
That's a good thing. Yeah, of course.
Yeah.
Yeah, and a lot of the beard extraction we actually do below the jawline, so it's quick healing. It's a lot of doctors don't feel confident about doing much extracting in the neck. I've actually worked on vascular surgeons and asked them, how deep would I have to go, to hit anything major? And they're like, you'd have to go deep, much deeper than that punch. And it's true. And it is shallow. And it's safe. The numbing is safe. It's very easy. So, yeah, I mean, like I said, I'm here to help. I think of patients sometimes that go through something like you've gone through, and kind of the possibility door has been shut, and I think of it almost like a climber on Mount Everest who's struggling and nobody helps them. They kind of die in hope, and that's not the kind of doctor I am. I love to have more of a proactive, positive, healing type approach, and especially what you've been through. I mean, you want to get past this, you know what I mean?
Yeah.
And kind of shut the door on that whole nightmare of cancer and going through the chemo and everything.
Right. Well, the other thing too about I'm not really looking for a lot because, I'm not tuning my own horn, but I look pretty decent, bald, but I just would like a little bit, I don't want to be, completely bald, but just a little something. I know I'm not going to look like I was in my 20s and 30s, but just a little something.
Yeah.
Would be great, and if I feel like if my beard is there, there has to be. I keep telling Joe, poor guy, I text him all the time on Instagram. I'm like, there's got to be somebody that helps.
Well, another thing, people talked about getting 2,500 from the donor site. I wouldn't necessarily recommend that at one time, but we can do a no shave or even a long hair approach to the donor site, so it's concealed. And like I said, the beard heals so fast. We use direct hair implantation for placement. It's really clean, great directionality, and patients leave and they're like, I can't believe it. It's crazy. Yeah. So
Hey,
I'm all about concealment.
Dr. Daniel, let me ask you. Sorry to interrupt, but I'm curious. When you said you're talking to the facial surgeon about the depth, what is the average depth? Would you say is that of a beard graft compared to, say, a scalp graft being more or less 4 millimeters? What is it for a beard graft?
It's going to be 3 to 4. I mean, head hair is more like 4 to 5. You know what I mean? If it's, Asian patients could be 6,
Yeah.
Occasionally we get patients, and really it's obviously the curl with people with African style hair, especially if they're really dark skinned and kind of Western African, that can be very hard to do. And I find culturally, there can be a little bit more difficulty with Indian patients, kind of that region. Otherwise, it's fairly cut and dry and simple. Yeah.
Very good. Very good. John, you got any more questions for Dr. Danyo?
Well, how do I sign up?
Yeah, I think that's
one step at a time.
Yeah.
One step at a time.
Yeah. You want me to give my number out to you?
Oh, absolutely.
Okay. Yeah. So the office number is 678-845-7521.
Hold on one second. Yeah, I think you broke up a little bit.
Oh, okay. Yeah. So Yes, 678
Mm-hmm.
845
Mm-hmm.
7521.
7521. Okay.
Yep. And you can find us
I will.
online at nahairrestoration.com. So that's as in North Atlanta.
Gotcha.
I'm
All right. I
I'm,
will
I'm adding
reach
the
out and
website to the description of this video right now, actually.
Yeah, and we can do an online consult. I do all the consults. I don't have a sales team. I generally do them on
okay.
Monday and Wednesday nights, or a time that's convenient for you. And I spend as much time as need be, and
Okay.
looking at everybody individually. Yeah, you're a
Would you
special
want
case.
right? Would you want also pictures?
Oh, that'd be great. And when you call the office, they'll walk you through the whole process.
Okay.
Yeah,
Great.
Yeah.
awesome. I
So
appreciate you.
so for everyone watching, I did put Dr. Danyo's website down in the description. You can check that out now. John, you can refer back to that if you misplaced the phone number you wrote down.
Great. I will do so.
All right, John. Good luck with everything,
Well,
and glad you called. Good to hear you again. And yeah, we'll talk again soon, I'm sure.
And
all
John,
right. I'll keep you posted.
I'm happy to help.
Thank you. I appreciate it. And thanks, Joe, as always.
Yeah. Take care, my friend. Bye-bye.
Ciao, guys. Bye.
Ciao. Okay, phone number is in North America 1-888-491-0512. If you're in the UK, it's going on midnight there, but a lot of you guys are hair geek enough to watch it this late hour. Number is 020-8126-7771. We are live out of Vancouver, British Columbia, and Atlanta, Georgia, with Dr. Danyo from North Atlanta Hair Restoration, basically the newest member of hairtransplantmentor.com. Just joined a couple of months ago. I've known Dr. Danyo for several years, and it's nice to have him on board after all these years. Yeah, it was a nice call from John there too. And someone else is trying to call right after he did. And I do appreciate the effort, but I can only take one call at a time. So feel free to call back again, and I'd love to answer your questions, talk to you with Dr. Danyo. Doc, what now you're talking about your PA, and again, we might have a call coming in, so I'll interrupt you when that comes through. But can you tell me more about your PA that's been working with you?
Sure. Well, first of all, so many of the patients that I do consults with, they want to know how much involvement do you have, who's involved, and I think one key thing to realize is that hair transplant can be done by myself, but if it's say like 2,000 grafts, I mean, we're going to be there all day and possibly all night. So you need a team. So we have really built a foundation of efficiency that I feel is just unmatched with what we have going on in the office with the medical assistants that provide. I don't call them technicians because I think of technicians doing kind of illegal parts of the case, whether they're coring grafts or doing surgical slits or things like that. My medical assistants pull grafts and load and planter pens and keep you comfortable.
Yeah.
But my PA, my physician's assistant, has been with me for about 3.5 years, and it allows us as a team to do things simultaneously. So I have been able to do 2,000 grafts, even shaveless, in 4 hours. It seems impossible. But we're able to core, pull, load, place. And it is something that we work on all the time. There's positioning aspects. Oftentimes we're moving from side to side. I have been doing transplant, both extraction and placing, with both my left and right hand for about 5 years now. And that allows me to get into a position where I can use my left hand, and I do it just as fast as my right. It gives my right hand a break and allows my technician to come in at a different angle because I've already cored an area. So I like to say it's kind of musical chairs.
Mm-hmm.
And this is in the context of also placing grafts and using direct hair implantation. We use lion pen implanters,
Yeah.
which I think for us, we've tried them all, seems to be the best fit for us.
Mm-hmm.
So, but I do all of the hairline work, any side temporal work. I do the majority of the extracting. And oftentimes, if we're doing beard and head extraction, or if we're doing body hair, if we can have 2 people extracting, two people pulling, it just makes a very long procedure so much faster, and
Not so long.
and our out of body time for the grafts is greatly reduced. So
I was going to ask you about that. Can you have you guys do you document the out of body time for the grafts for each patient, or is it just something you observe?
It's more of an observing.
Okay.
I mean, we've greatly decreased our time. There are many patients that just want me to do all the extractions and all the placements, and I mean, it's hours longer. I mean, because you
Yeah.
have to get everything out, and then you have to get everything in. Now, I'm very fast with extracting, and I'm very fast with implanting. But if you are implanting the whole time you're extracting, and then you just have mainly the hairline and kind of the major parts left for me to do, it's huge.
Yeah.
There are many times that literally the grafts are being pulled and being placed into implanter pens, and there's nothing better for the graft.
Right.
So
Very minimal out of body time for sure.
yeah, and when we're doing a crown, positionally, because of the swirl, it actually works out better if you're placing at the same time that you're extracting.
Yeah. And Eagle Rock in the chat room, he's got a couple good questions. The first of which is how much of the procedure does the other doctor, and you can name the doctor here, how much does he perform?
Yeah, Dr. Matt Goldstein.
Yeah. How much of the procedure does he perform, or does he perform his own procedures?
He is doing his own procedures.
Yeah.
He's been with me since October of last year, does a super job, and oftentimes works with me. And again, because we're constantly working on efficiency, we're able to double extract in place. We have a great video on YouTube where I actually had 2 PAs up until she's on is pregnant and is due actually next month. But great video where we actually are double extracting and placing, and it was a 2,500 graft case from the chest and abdomen, and he had a 4:30 flight, and we started at 7 a.m. and we actually got it done. So
nice.
But Dr. Goldstein does a super job. He does his own consults, and we work together frequently.
And the second question Eagle Rock had, and I'd like this question a lot: are the techs longtime employees, or are they contract techs?
No contract techs.
I refer to them as HAPA clinics. So
no. So my main tech, like my lead tech, started in 2018 and has been with me every step of the way. That's about what the time we met. Back then, we called this a craft. I mean, I was still building my craft, and she's been there every step of the way. And really, everybody loves her. Her name is Renee. And my 2 other main techs have been with me for about 2.5 years and do a phenomenal job. Everybody's on board. We all use, my technicians use 4.0 loops. They're Zeiss loops, which are great with headsets, and they have their own light. We do double-handed graft extraction for pulling grafts, and everybody's on board. And we do a lot of no shave and now long hair procedures,
Mhm.
and their involvement finding grafts and moving the case along is just massive.
Yeah. That's nice
Yeah.
to hear. Yeah. Again, people, the phone numbers to call in, talk to Dr. Danyo and myself here on the main event. North America, it's 1-888-491-0512. In the UK, it is 020-8126-7771. Would love to hear from you guys. If not, that's fine. We're going to keep bantering back and forth and getting some questions answered for you guys. But we're not going to do it forever. So give us a call and we'll talk. Excuse me.
Now, Joe, he brought up kind of tech-driven clinics. I mean, it's an issue probably in every city in the major city in the country.
Oh, yeah.
And there are kind of legal questions whether they should be doing a medical procedure, and there's a bait and switch. Oftentimes I hear, "Oh, the doctor, I met him at the beginning, and then he couldn't be found." So
right, yeah, it's very very common, and the big introduction of that concept. I mean, when you look at techs doing part of the surgery, that was actually part of the baseline of how hair transplants were performed for many years, even before FUE came about with stick in place being very popular with some doctors, some well-known doctors such as Bobby Limmer. You had David Seeger in Toronto. These are names that were around long before you. But then that kind of made a resurgence as far as non-licensed medical personnel performing part of the surgery, where you had NeoGraft introduce the idea of this, or reintroduce the idea of this en masse.
The neografters.
They were called neografters, and you could actually download the app onto your phone as a clinical director or manager. You didn't have to be the doctor, and you could pick and choose the app on the app the neograft techs that were available in your area for that day. And I remember discovering that several years back. It was one of those moments that remind me that after you think you've seen everything, you haven't seen everything.
Yeah, different states have different laws. And my medical license is in Georgia, and I've done a lot of research on this. And I mean, if you look at the definition of surgery, it's the extraction and manipulation of human tissue.
Mm-hmm.
And if you do kind of a deeper dive, hair transplant is a surgery. It's classified as a surgery, and it's exactly what it is: the extraction and manipulation of human tissue. And the rules in Georgia, at least, is that component, extraction and manipulation, has to be done by a licensed provider. Now, that could be a physician. It can also be a physician's assistant, PA, or nurse practitioner under the direction of the physician.
Of course.
Yes.
I think it's important to distinguish, though, when we say the extraction, it's actually the scoring of the graft is what's required, or is what a licensed person is required to do. Whereas extraction, as you were referring to earlier, the pulling of the grafts, that's only after it's been scored and cut away from its anchoring tissue inside. So it's literally sliding it out after it's already been cut. So it's a very, very important distinction between the two. And so I just didn't want any of the listeners to get that confused after we'd already been talking about that. But that's the way it is in a lot of the states. But the wording is so ambiguous. There are loopholes, and that's why it still persists to this day. For better or for worse.
The other crazy thing is just the management of medications. I mean, lidocaine in and of itself can be extremely toxic if not injected properly. And especially epinephrine, which is mixed in, can be very, very tough. It can cause a lot of problems. and just managing a long case. If the case is not moving along, you're adding more medicine, creating more trauma, more chance for side effects. And even I've seen patients getting sedated without a physician present, which is an absolute no-no.
Yeah.
So I think for anyone listening, just you need to do your research and figure this out.
Yeah. Well said.
And unfortunately, there is a bait and switch off that oftentimes happens.
Yeah.
Yep.
I've heard of some crazy stories, and it's the issue of lidocaine toxicity. You mentioned lidocaine, and it just reminds me of a story. Not a story, but a situation I was discussing with another doctor where you just don't know what's going to happen with lidocaine, and if it's a technician that administers, I mean, obviously that's not what you want to do, but even if a doctor or even an anesthesiologist that understands this stuff, it's like, well, anything can happen. And that's part of the warning I'm always giving patients is, and even on Reddit where I'm engaging with a lot of people, is you just don't know what's going to happen. And just because it may be presented as easy, just because people that have gone through it came back and said it was easy, doesn't mean it's going to be easy for you. There's always that odd man out that's going to have some sort of adverse reaction, which is perfectly normal, but it's rare, and can't really be attributed to, the lack of a medical license or not. It happens to anyone. Unpredictably, but the advantage of having a licensed person in charge of this is if that does happen, they're more likely to be in a position of understanding what to do to deal with it. So that's a big deal. And of course that's your background is pain management. So you know a lot about that as well.
Yeah, exactly. But I've been in medicine since 1990. That's when I started medical school. So almost 36 years now of training. And, people get kind of caught into this price model, commoditized model where they're getting it at such a low level, but you're giving up something, and you're generally giving up physician involvement, and you can roll the dice. Sometimes it works out, sometimes it doesn't. Yeah. And I think it's better to have more of a value approach and have somebody or a clinic that's going to look at you as an individual, treat you as such, and give you the best results possible and safest. Yeah.
Before I get to the next question, I just remind people lines are open. North America phone number toll free 1-888-491-0512. If you're in the UK up late at night watching the broadcast, we are live. You can call in as well. The number is 020-8126-7771. We're live with Dr. Danyo out of Atlanta, Georgia. North Atlanta Hair Restoration.com is his website. You can check him out. I'm curious what you think about the state of the industry as it stands today with regards to the number of strip mall practices that you're seeing now versus maybe before the pandemic. Actually, I think that's a good timeline to compare. What are you seeing out there?
I think it's similar to what I've seen in pain management. You could take a weekend course on how to do an epidural steroid injection or a radiofrequency ablation, and people would start doing it in their office and have really catastrophic events when you're dealing with a spinal nerve or the spinal cord or something like that.
We got a call coming in right now from the UK. Hey, thanks for calling. You're on the main event with Dr. Dan Danyo and myself, Joe Tillman. What's your name? Where are you calling from?
Oh, yeah, it's Topstar from Mildenhall in England.
Topstar, how you doing, man? What's going on?
Yeah, fine. Long time no speaky.
Yeah, long time you no speaky. Right on. What can we do for you?
Do you remember me?
I do, yes. Long time caller of the Bald Truth.
Yes, one of Dr. Barty's successful, happy
Yeah.
customers.
Yeah, exactly.
Or
Exactly.
patients, whatever you want to call it.
Yeah.
Am I on,
Hey,
on the air
hey,
now?
You are.
hey, Top Star, it's Dr. Danyo.
Right, hello. Yes, what can I say? You know, it's great getting through to you again, Ensign Tillman.
Yeah. It's nice to
From
hear
another
from you.
mariner.
Yeah.
From
Yeah.
yeah. I've written 2 books since I last spoke to you.
Really?
Can I say?
Yeah, of course. Go ahead.
Yeah, it's the new guy, Stallone Schwarzenegger, and the Golden Mamba is the latest book.
The golden
And,
number. Okay.
Mamba,
Oh,
you know,
okay.
the snake, the Golden Mamba.
Got it.
Yes, Stallone Schwarzenegger, that's the Stallone Schwarzenegger series.
Uh-huh.
And the website, may I say the website?
Yes, you may. Yes.
Yes, sailorcrew.fun.
.fun.
And that is, .fun. That is the new comic. The comic.
Okay.
Dice Comics. It's my new thing.
Sailorcrew.fun.
Yeah.
Got it.
Anyway, thanks for that.
Yeah, no
I
worries.
will ask my... hello, Dr. Danyo?
Dr. Danyo. Yeah, hello.
Yeah. Yes, hello. Okay, I'm in a bit of a conundrum.
Mm-hmm.
I don't know if... Well, I had a beautiful Hollywood hairline. 6 years. It'll be 6 years in 2 months' time, in February.
Okay.
I'll have had it 6 years, and it's still every day I look in the mirror and go, oh, praise the Lord for Dr. Barty's artistry and genius, whatever. And my problem is I'm a half biscuit. So I've got the beautiful front, lovely hairline, all the rest. I can't, and the top, but it's just a little crown. But I've got a very, now, my biggest issue is, remember what happened last time I went abroad?
Yes. Yeah, you had quite the
Yeah.
story.
Yeah, so I'm terrified. Now, I did receive, I've never been to Canada. My mum was from Willow Point, British Columbia, Nelson, and I got the Canadian citizen, but they're not going to let me in the UK. I mean, in the USA directly. So, but I'm desperate to go on this, to get this crown done, because I'm still very. But my problem is, since all this doctor, nonsense in the last 5 years, I have no confidence. I don't trust them. I'm absolutely paranoid. I haven't been near a doctor since basically coming back from India. I just don't, any needles coming near me. I want to try, because when I went to Dr. Barty, they were you got to have this test and you got to have that test, and they were doing all this heart bollocks on me. Remember that?
Yep.
He wanted to stop the thing in the middle of the thing. Oh, your heart. I said, I'm fine. What do you want about? And believe me, 6 years later, I'm perfectly fine. I did have a bad experience with oral minoxidil, though.
Okay.
Do you mind if I?
No,
I know
please
I'm not.
share.
I will ask a question, but about that, I had the terrible nightmares on. I did go on it. I had terrible nightmares, and then I had a terrible shed, but mainly in the donor. That was weird.
Okay.
My donor just went into total shed on oral minoxidil. But anyway, that was that. And then but I want to ask your guest. Oh, I'm sorry, I'm terrible with names. How do I negotiate legally with a doctor? Because I'm planning on a consultation with Dr. Ball. as well in
Mhm.
Southampton.
Mm-hmm.
And I know you were here, and I couldn't sort of get in touch with, because you did come over to see him.
I was
And I
in
would have,
I was in England just in this past February. Yeah, not just several months
I
ago.
know,
Yeah.
yeah.
Mm-hmm.
Yeah, no, it would have been nice to, but I don't think I was in a position at the time. But I am considering, well, I'm definitely considering a consultation with him.
Mm-hmm.
Thing is, I want to know how I can legally negotiate with these doctors and say, look, I don't want any tests. I want the bare minimum. I'm even considering going, what's it, ring block free,
Mm-hmm.
some kind of,
Oh,
I
yeah,
just don't want
without any
I just
sort
want
of
the head.
without any sort of needles for pain management. Yeah, I get it. As far as the legality of that goes,
I don't want it to surreptitiously. I'm so
yeah.
paranoid. I don't want it to surreptitiously give me the snake bite or something like that.
No, I understand. I understand.
Like,
but you have to
like,
you have to understand something. Okay, so one of the big, most important things that a doctor has to adhere to is do no harm, and performing a surgery without any sort of pain management is contrary to that credo. Okay,
Yeah,
and
I would agree.
I've seen this before, where a patient did have he did go in to have a surgery, and on the morning of the surgery he told the doctor he did not want to have any sort of pain management whatsoever. He was going to meditate through the surgery, and the doctor agreed to that. When I found out about it, I immediately dismissed him from membership as a hair transplant mentor doctor because it was grossly inappropriate for the patient, not just for the clinic, but also for the patient, because he put himself in great jeopardy as far as liability. He made a decision on the spot when the patient requested it. It should have been something that should have been requested. To be fair, the patient should have requested it weeks ahead of time, and to give the doctor time to properly consider it and to look at it from the point of view that he should have looked at it from. He agreed to it on the spot, and I won't go any further into it, but that's not safe for you. It's not safe for the clinic, and I understand your trepidation on that.
No, I appreciate that. It's really just that, he said, "Oh, I must have a ECG for my heart," and
no, understandable. Well, they have to monitor, but I'm going to let Dr. Danyo jump in here, because there may be some sort of oral sedative that can help.
Yeah,
no, it's not it's all the initial tests. They want to do an ECG, and then you got to lie on this thing with some other consultant, and it's all sticking in. I don't want any of that. I just want to go.
I'll let Dr. Daniel continue.
Okay.
Yeah,
Thank you.
I from my perspective, I rarely, if ever, do it. I have worked on patients that have had pretty significant medical issues, and that's when we talk with the treating physician and get clearance. But the vast majority of folks, I think, when you do your initial assessment, blood pressure, pulse, pulse ox, with safe injection therapy, this procedure can be done safely. As far as not getting medication injected, nerve block wise, the biggest thing is that all those repetitive sticks, you will get a huge bump in cortisol as the stress hormone. And the cortisol is going to drive your blood sugar down and create a whole set of circumstances that will likely stop the case, before you would want to. But as far as going through all the rigmarole, I would say most physicians don't that do hair transplant. And it's a very forgiving procedure if done properly, very safe, with very few complications. But at the same time, I mean, there was a recent death in Turkey, and I don't know the actual circumstances there. Joe,
no,
you
this
might,
wasn't Turkey. It was India. I was hooked to this machine. I had a intravenous, antibiotic thing in me. I don't want any of that. I don't want to be hooked
yeah,
up on a machine with a thing on my finger saying, "Oh, your heart's my heart's fine."
I don't do any, I
You
don't
know.
do any of that type of monitoring unless I
Oh,
need
right.
to. Yeah.
Oh. No, they were very, very sort of sticklerish with it. I mean, he's beautiful
Medicine.
result, but
Medicine through training, I think, infirmatizes patients. And when you're hooked up to an IV and all the machines, as you're going through a very long procedure, I mean, it creates almost like an ICU environment, which is unnerving. Um, but that's not my style. We have
and he was
resuscitated.
saying to the consultant, sorry to interrupt, he was saying to the consultant, "This guy's a nervous guy," and then he was having a. I mean, look, don't get me wrong, but he's a beautiful chap. But he was having a sort of wanting to fire the consultant because he was. Why didn't you tell me his heart wasn't? Because he just given me the ECG, and then he said I was fine, and then there was a big, so I was like, oh.
I think
And
what
as I
you
said,
need,
he was
I think what you need
somehow
to
I was
do.
bleeding all over, and
Sure.
so he did very well for the.
I think what you need to
Sorry.
do is I think you need to do your due diligence, and you need to talk specifically what each office does, and it may take multiple consultations, but you need to speak directly to the physician to see what their style is,
Very
because this is
difficult
kind of
because
a
I tried to get an appointment a couple of months ago, and it's like, you just get the PAs and the secretaries, and they want to phone you back, but I don't answer phones, and it's a nightmare. You email, But yeah, so what's that Canada border? Because I've got my Canadian sister. If I can I just walk across there?
What
Canada?
from Canada to the States?
Yeah.
There's no blanket answer for that. It's pretty open, but I mean, you still got to go through the border. They look at your passport and they do what they got to do. But yeah, I mean,
no eye on these eye scans. You see, it's all this is becoming a nightmare.
It's
you know what I mean?
Well, I mean,
that's
a different subject, but for a different show. But the idea of eye scans, I don't think that's mandatory for non-citizens of the U.S. yet.
Oh no, they say if I fly from the UK directly into US, it's a big. Oh, they want it all.
Well, I mean, I think it's best to go to the U.S. State Department website and find out for yourself instead of these people say this, these people say that. Always go to the source on that, and the source for those questions is the State Department.
Deviating from your guess.
Well, I mean, it's a different subject, but I mean, it's related to you coming to the States if you want to get surgery. I can't answer that. The only place to answer that is on the State Department website.
It will be too expensive for me.
What
would he do for 1,500 just for the crown? Because that's what I was quoted. I've still got all my rest of my hair. It's right up to my what do you Cornish?
No one can give a quote over a live stream.
No.
I would have to. I do.
Sides aren't dropping at all. Yeah. 60 now, not a grey hair.
You're 60 now?
Yeah, I'll be 60 in 2 weeks.
Okay.
28th. But
happy birthday. Well, hope it's a good one for you. Yeah. But look, do me a favor. When you go to like if you're going to talk to Dr. Ball, call back on the other show sometime and let us know how that goes. Okay, because I'd be interested to know what he says about your case. All right.
Yeah, because I see he seems to be quite an expert with not doing, not having a lot of graft. I don't need a lot of grafts because my hair's
Well, he's the guy for you because he doesn't do a lot of grafts. So that should be a good, probably be a good matchup. So, but look, Top Star, I'm glad you called. I'm going to cut you off. We need to move on to the next.
Thanks for listening to my.
Yeah.
Anyway, just one thing, Morty Zipkov, Shabbat Shalom. You must phone in.
We've not heard from Morty in a long time. I hope he's okay though.
Yeah, well, we're thinking about you, Morty. Phone in. I know my mum died, so maybe his as well. I don't know.
All right, thanks, Top Star. Take care of yourself.
And another thing, if you don't want to go grey, have got no grey. Faux tea. It's a little herb, the Chinese herb. Faux tea.
Good stuff, buddy.
Been taking that. Anyway, thank you.
Yeah, thanks.
All the best.
Take care.
Hello, Spencer.
Cheers.
Say hello to Spencer.
Will do. Bye-bye.
Bye.
All right, lines are open. We got North America 1-888-491-0512. In the UK, it's 020-8126-7771.
And Joe, I wanted to say one thing. You know, everyone has a different style of comfort when they do a procedure. You know what I mean?
Yeah.
Mine, based on training experience, can be totally different than others. So,
of course,
I think ultimately it's the results, and the care during the procedure varies as far as monitoring. So I didn't want to place any doubt there.
No, and I appreciate that. And of course, every clinic has a different approach, or generally different approach, be it small differences or bigger differences, of course. I think that, what he was talking about, he was talking about two things: the initial pre-op, basically the pre-op checks with blood pressure, EKG, things like that. That's what he doesn't want to do. Mm-hmm. And as far as I'm concerned, based on my experience, that's a non-starter, because that's protecting the clinic's ass and the patient's ass, making sure that the patient's in the right condition to move forward with the surgery, which is stressful on the body. And so I understand where he's coming from. He had a pretty bad experience previously, as far as that goes, but that shouldn't force the next clinic to compromise their own procedures as well to accommodate him. So I understand his position, but I think that he needs to come around to understanding how things work in the medical field before he moves forward. So it's just my opinion, but I appreciate you clarifying that. Eagle Rock in the chat room wants to know more about your practice. I told him, I was like, the best way to find out is to call in and ask questions himself. So Eagle Rock, the number's there. 888-491-0512. I don't think that you're in the UK, but it's 020-8126-7771. Dr. Danyo, how much more time do you have?
Let's see. As much time as you need. So, and as much interest that's out there. So I'm happy to help.
I tell you, it's like when I was asking a question, my stomach started to rumble because I'm on this crazy keto and intermittent fasting combination. Yeah. And man, it's been successful so far. Like I did it for a couple of reasons. One, to help clear up a skin issue I was having, see if that will help, and it seems to. But also just to kind of reset everything and lose some weight, and everything seems to be working the way I want it to.
More energy, everything. Better sleep.
Yeah. Oh, absolutely better sleep. So that's good. But I still get my hunger cravings, and not for like bad food either. Just I want a steak right now. So, but it's a good way to suffer, I guess. There are worse ways to deal with it. What else can we talk about? What was there? You sound like there's something else you want to talk about, like something.
I mean, he asked about my practice.
Yeah. Okay.
Yeah. I've always been a hands-on physician, and I've kind of challenged, even when I was in pain management, how certain things should be done
Hmm.
to better the experience and better the convenience while keeping safety. And it's just a constant review of what worked and what didn't work. I mean, there are
Hmm.
many times, throughout my career, I've been a physician now since 2000, so 25 years, where I'd say I'm never doing that again. Um, and
Yeah.
but then, we talked about variables, and you throw in all these variables. It just takes a lot of time to be able to sift through the variables and respond so that we get optimal results.
Hmm.
And I don't know if there are a lot of physicians that are quite as tuned in as me. I think I do, the extracting and placing at a level that a lot of doctors would say, "Man, you're going to get tendonitis, or you're going to burn yourself out."
Hmm.
Um, but that's not the case. I mean, there's a passion there to deliver, and a lot of these cases are long and tedious. But for me, I have the mentality to do long, tedious procedures and hang in there.
Well, I think part of that comes down to when you get into to this kind of or any industry actually. If you have the right mindset at the beginning, where it's tedious, it takes a lot of hard work, and that's what you accept from the beginning. I think there's a huge difference in that versus coming in only to later realize, wow, this is a lot of work.
Yeah.
And you know, early on, your attitude about how you see it, not how you guess it's going to be, that's what indicates how you're going to carry on, 5, 10, 20 years later, because it's just part of the innate nature of what you got yourself into. You enjoy the difficult aspects of it because
Yeah.
that's the way it was from the start, and that's what attracted you to it. Um, these
I
weekend
think,
course guys, they don't, they don't understand that.
sure. And there's a lot of focus on the procedure, on the device. Um, but there's really not a lot of focus on the actual mental component. And I think one of the huge components that I've seen, especially with my patients, is concealment. I mean,
Hmm.
for whatever reason, hair transplant is still kind of on the embarrassing side of things.
For a lot of guys,
Uh,
yeah, and women.
it's just not something that most people. I mean, we occasionally get people that just they want to broadcast everything, and
Yeah,
that's great. But the vast majority, what they want to keep it low. They don't want anyone to know,
yeah,
and they don't want to make it so obvious with like a weird hairline, a weird haircut, and that's where the art comes in. And it's really being empathetic to that. I've had 3 hair transplants, and they've all been shaved. And for me,
hmm,
the recovery I thought was a little bit tougher because you're laying on bristly hair. And
yeah.
I mean, there were many things that socially I just said, I'm not going.
And you had another one recently, right? Just like 3 weeks
Yes.
ago. Was it 3 weeks
No,
ago
no, no.
or a
8
month?
weeks ago.
Was it
8
8?
weeks. Yeah.
Oh
This Friday will be 8 weeks. Yep.
oh my god!
They're in a
I
time capsule, Joe.
time flew by for me because we were trying to do this earlier, and it
Yep.
was like the week after, or the week before, then the week after, and then I got so busy with unrelated things that it's just time completely slipped by. But yeah,
Yeah.
8 weeks. Wow. Okay. Well, you look fantastic as it is, so
Oh, thanks.
it's good healing. Um, I want to talk about. We touched on this before we went live, and by the way, everyone, lines are open, toll free, North America 1-888-491-0512, United Kingdom 020-8126-7771. I want to talk about adjunct therapies or uh, enhancements to hair transplant surgery as it's offered today. I've been a big believer over the years that these treatments that have literally come and they come and go every day, it seems, exosomes, PRP, and every variation of those that seems to be presented by whatever clinic wants to put their stamp on it. I'm of the belief that good surgery doesn't need enhancement. The human body is a tremendous machine when it comes to healing. You just have to make sure that the materials are there for it to do its job, and that material is clean cuts, clean closures, proper placement. Good resources, which is the donor, kept intact, extraction, placement, the whole 9 yards. It's not necessary to do, I mentioned before, thanks for coming in and paying us X number of dollars. For $500 more, we can make sure it heals even better with PRP. I just don't understand that. And
well, the other side
hear
is
your take
well,
on
the
that.
other side is if you book now, we'll give you a free PRP, kind of as a sales.
Oh yeah,
pitch.
of course. The inducements to have surgery,
Yeah.
to fill the spot that just became open. That was actually open for never filled. So
exactly. So I'm not a sales guy. This is a surgical medical procedure, and we try and work with people financially, but we're not in the business of discounting things and running all these promotions. My thing with PRP, I started doing PRP and pain management probably as early as 2007. Now, in the pain management realm, I mean, I had some really good results, whether it was injecting knees or hips. I even did some intradiscal PRP injections with great results, tendons, things like that. In the hair, for the head, I have had some patients do well, but it's generally when there's kind of diffuse miniaturization, especially women that maybe have had some telogen or shedding and have some miniaturization. I've had some female patients do well, or younger male patients that are at the start with combined medical therapy with either oral finasteride or oral minoxidil or topical.
Yeah.
But in the realm of doing surgery, whether it's PRP, exosomes, I'm not a huge fan of stem cells.
Yeah.
And keep in mind that the FDA has not approved exosomes for injection or stem cells for cosmetic purposes unless you're in a research project. So, but then physicians have medical licenses, which the FDA cannot kind of restrict medical license. But with that said, I have not found PRP to be an effective adjunct during surgery. I think it really adds a layer of inflammation, the chance to maybe have a fainting spell while you're drawing blood. It can really make things, especially our more efficient way of extracting and placing, make it very difficult. And I stopped doing PRP about 3.5, 4 years ago. I actually feel like my patients do better, have easier healing, less swelling, less pain.
Yeah, it makes sense. And I know a lot of very reputable clinics that do have those types of offerings, and I've talked to a lot of them directly, and they tell me straight up that they feel that it does add some sort of benefit, and that's fine. I just don't, I see claims by some clinics that say, oh, well, with our protocol, we're seeing growth in as little as 3 months. I was seeing growth before 3 months from strip surgeries 20 years ago on myself.
Yeah. And that's
wasn't even a
variable.
thing.
Well.
What's that?
And it's variable. I mean,
of course. And that's the thing is it is variable. It reminds me of a study that was cited as a reason for offering PRP post surgery with over return visits, like 3, maybe 4 visits in the first year post-op to enhance the healing and speed recovery. And I actually challenged the doctor on this. I said, well, which study is this? Because that was his word. Those are his words specifically, based on studies, plural. And he sent me a link, and it wasn't a study. It was observational, anecdotal review of comments, or I forgot the specifics of it, but it wasn't a study, and it's just a reminder that sometimes clinics will take whatever positive information that they can grab and apply it to what they want to offer, and I just don't see the benefits of it across the board.
Hair transplantation is not a cheap procedure. And if we're going to add a laser cap, we're going to add these supplements and PRP and just say, oh, your results will be so much better and enhanced. And without it, I don't know, you're not going to do as well. Yeah. That approach, for one, it almost can't be proven, because you would need double-blinded placebo-controlled studies, which haven't been done and are very difficult to do, and it'd have to be a huge study to prove anything.
Of course.
But you're kind of forcing people to buy things that they may or may not need, and kind of having that little bait saying, if you don't do it, it's not going to be as good.
Well, there's also the argument that I've presented. If it works so good, then why are you making me pay extra? Like, why not include that? Because you as a practitioner, it's your duty to make sure I have the best outcome possible, just based on the medical ethic. Not forget the fact I'm paying you thousands of dollars. The ethics involved with this demand that you ensure I have the best outcome possible. So why not include it? That's just how I look at it.
Yeah, but I think if there's any kind of transfer of money to say that you're not going to get the results without it when it's not been proven, it's just not my approach.
I wonder if it also offers an out if the result isn't great. Well, we did offer you PRP and you said no, so there's that. Sorry. Yeah, I don't know if it's ever been used in that context, but I'm sure it has. I can see I can see the avenue for that opportunity to deny responsibility quite easily. So,
correct.
Everyone in the chat room, or if you're not even in the chat room, just watching, listening, lines are open: 1-888-491-0512. UK is 020-8126-7771. I am going to wrap this up here shortly. With respect to Dr. Danyo's time, and I really appreciate you coming on board. I'm glad it worked out, because we've been trying to do this for past couple months, and one time it was due to my own
I have a studio in my office. So
yeah, and let's talk about that. By the way, you have your own podcast that my viewers and listeners can tune into. Can you tell us more about that?
Sure. It's called Hair Restoration with Dr. Danyo. We've had a little bit of a pause over the last 6 months. We've gone through some different marketing company changes and kind of a different approach, but we're getting ready to wrap it up. And it's just really, it's not a salesy podcast. I get feedback from people that listen to it, and they just said it seems like an honest approach to what's going on in the industry, what's available for patients. We talk about female, male hair restoration, hair transplantation. We talk about ethnic hair, and shaveless versus shaved, all different aspects. And try not to get too controversial. But we've got great feedback. It's a way to get to know my practice better, get to know me better. As we move forward, my new associate, Dr. Matt Goldstein, we're going to be doing it together, as well as my physician's assistant, who really is just has been a great addition.
Where can people find this?
It can be found on from an audio standpoint on iTunes and on SoundCloud, as well as Spotify. And you can find it on YouTube, and I think online, if you just look up Hair Restoration with Dr. Danyo. I forget what actual site where it's housed, but it's there.
Okay, fair enough.
And we have our episodes on our website, nahairrestoration.com.
There you go. NAHairRestoration.com. NA stands
Yep.
for North Atlanta. So
Correct.
you guys can look that up and check out Dr. Danyo. I guess that's it. It's been a great show. And Dr. Dan Danyo of Atlanta, Georgia, I really appreciate you being on. We will do this again. And yes, I'm supporting my new setup, not just a new studio, but a new setup as far as
That's
software
beautiful.
and all that. So really happy with that. Really happy it worked out today. You're the inaugural guest for this
Awesome.
new setup.
Happy to be that.
Yeah.
And Joe, I really appreciate what you do for the industry. It's just a sound, practical approach to an industry that at times is you just shake your head at.
I do that a lot.
Yeah.
Thanks a lot for saying that. I appreciate that. And yeah, so like I said, people watching this, if you want to learn more about Dr. Dan Danyo, you can check him out on my website, hairtransplantmentor.com. He's an accepted member as of I think it was late September or early September he came aboard. You can also check him out on his website, NAHairRestoration.com. That's Dr. Dan Danyo out of Atlanta, Georgia. And yeah, of course, with this broadcast, if you like this broadcast and the subject matter we've been talking about, you learned something, or you just thought was nice to fall asleep to whenever you're watching it or listening to it, hit that like button for me. It really does help to contribute to the algorithm finding us again. And if you're not a subscriber, please hit the subscribe button. And don't forget to hit all notifications so you're notified when I go live again. With that said, I am out of here, and hopefully I can figure out how to turn this off real quick. Thanks for watching, everyone. Take care. Bye-bye.